Hey, party people. Happy Wednesday. You're Wednesday closer to Friday. You know what it is. I am Monique, pronouns she, her, hers, and I am the community health coordinator here at Whitman-Walker Health. It is Wednesday, and we are continuing our STD Talk series. And today's STD is gonorrhea. So before I jump into that, I have housekeeping stuff to do, to talk about, so I will read that off right now. So, Whitman-Walker Health's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STIs, sexual health practices, access to care, social determinant of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. Well, I have decided to give COVID-19 a little break. We talk about COVID-19 a lot. So I started this STD Talk series about end of November-ish. So we're just continuing. I think the first one was herpes, last one was chlamydia, and today we are talking about gonorrhea. So, even though chlamydia, we talked about last time, is one of the more known STIs among the age range of 13 to 24, gonorrhea is also very, very common. And we see that we see gonorrhea infections, actually co-infections with chlamydia, a lot here. So gonorrhea is also one of the STIs that we test for here at Whitman-Walker Health. And just like chlamydia, we test for gonorrhea in several different ways, as it tends to be localized during infection. Meaning, a person can be infected in their vagina or urethra, but not in the throat or anus, or vice versa. So, let's get started. What is gonorrhea? So, gonorrhea is a sexually transmitted infection that infects both men and women. It can cause infections in the genitals, rectum, and throat. And it is a very common infection, especially among young people ages 15 to 24. And I talked about why that is when I spoke about chlamydia last time. And that is because that age range, specifically 13 to 24, specifically 13 to like 21-ish, your bodies are still developing. So because you're still developing, you're more susceptible to catching infections. Or any sickness for that matter, because your body is still developing. It's still, working itself out. So how do you get gonorrhea? You can contract gonorrhea, by having vaginal, anal, or oral sex with someone who has gonorrhea. A pregnant woman with gonorrhea can give the infection to her baby during childbirth, same as chlamydia. If you have had gonorrhea and were treated in the past, you can absolutely be reinfected if you have unprotected sex with someone who has it. Who is at risk for getting gonorrhea? Like I said just a while ago, gonorrhea is more common in young people, especially those 15 to 24 years old. You are more likely to get it if you don't consistently use a condom, or if you have multiple partners. What are the symptoms of gonorrhea? So some men with gonorrhea may have no symptoms at all. However, men who do have symptoms may have burning sensation during urination. Also same with chlamydia. The difference here is with gonorrhea, men will have white, yellow, or green discharge from the penis. So for men, only thing that should come out of the penis is urine and semen. And I'm going to include pre-cum under that umbrella of semen. So urine, semen, including pre-cum, is the only thing that should come from your penis. If you have any other thing coming from your penis, it is a sign of infection and you need to go get treated. Okay. And then another symptom that men have are painful or swollen testicles, even though that is less common. Most women with gonorrhea do not have any symptoms. And if you remember from the last live with chlamydia, most women usually have symptoms with gonorrhea if there is symptoms, and men usually do not. Now with gonorrhea, it's the flip. Most men will have symptoms with gonorrhea, and most women actually will not. So again, even when a woman has symptoms, they're often mild and can be mistaken for a bladder or vaginal infection. Women with gonorrhea are at risk for developing serious complications from the infection, even if they don't have any symptoms, which is why it's important to get tested regularly. Here at Whitman-Walker Health, we recommend you get tested for STIs every 3 months. So some symptoms in women can include painful and burning sensation during urination, same with chlamydia, increased vaginal discharge, because remember, women, we already have natural discharge, like it's a naturally occurring process. So you need to know your body well enough that you know when things have changed. And then vaginal bleeding between your menstrual cycle. So if your cycle isn't really supposed to come yet, or just ended and you're having bleeding again, that could be a sign of infection. Rectal infections may either cause no symptoms or cause symptoms in both men and women that may include discharge, and this is from your anus. So discharge, anal itching, soreness, bleeding, and painful bowel movements. Okay? Excuse me. So, how is gonorrhea diagnosed? Just like chlamydia, most of the time, urine can be tested for gonorrhea. However, if you have had oral and or anal sex, swabs may be used to collect samples from your throat and or rectum. In some cases, a swab may be used to collect a sample from a man's urethra or a woman's cervix. And here at Whitman-Walker Health, we would ask for a urine sample and or rectal or pharyngeal swab. Pharyngeal is the throat. And you just choose whichever applies to you. So if you are doing oral sex, if you're performing oral sex, then you would do the pharyngeal swab. If you are having anal sex, you would do the rectal swab, and then also the urine. If you're having penetrative sex. Can gonorrhea be cured? So yes, just like chlamydia, gonorrhea can be cured with the right treatment. This is the kicker though. So chlamydia and gonorrhea, even though there are co-infection, they can be co-infections because they're not co-infections all the time. They can be co-infections. They usually walk hand in hand together. The treatment for both is different. So the treatment for chlamydia is one thing and the treatment for gonorrhea is another thing. So if you are infected with both, you would probably get both medication, an oral medication and then an injection. So gonorrhea can be cured with the right treatment. It is important to take all of the medication your doctor prescribes if you to cure your infection. Medication for gonorrhea should not be shared with anyone. Again, medication for gonorrhea should not be shared with anyone. Medication for anything that is prescribed, that was given to you by a doctor's order that you picked up from the pharmacy, should not be shared with anyone but the person whose name is on the bottle or on the prescription. Although medication will stop the infection, it will not undo any permanent damage caused by the disease, which is the same with chlamydia. It's actually, but this is very, very important. It's actually becoming harder to treat some gonorrhea strains because they're becoming drug resistant. So if your symptoms continue more than a few days after receiving treatment and you've taken the entire course of the medication, you should return to your healthcare provider to be checked again because it may be a strand that is drug resistant. So this was a question. I was treated for gonorrhea. When can I have sex again? Same as chlamydia. You should wait 7 days after finishing all the medication before having sex to avoid getting infected with gonorrhea again or spreading gonorrhea to your partner or partners. You and your sex partners should avoid having sex until you each have completed treatment. And it's very, very important. I think that a lot of young people, especially in the 13, to like 17, 18 range, you know what, I'll even bump it all the way up to 21, just because some people are just not truthful for whatever reason. But from the history that and how long I've been working, the reason is usually like shame or embarrassment, right? Like there's stigma, like, oh my gosh, I got an STI, or I got burned, as people like to say. I think there's stigma behind it. So, one partner will go get tested, get their results, and then get treatment, and then not tell the other person, especially if it's a person that, is like a one-off thing. Like we socially have sex. So it's not like you're my consistent monogamous partner. Like those people are like left in the wind, and now they are potentially passing chlamydia or gonorrhea on to someone else, because you didn't have the what's the word I'm looking for? Nice word that I'm looking for. Like you didn't have the courage, honestly, to say, hey, I got tested, came back positive for gonorrhea. You should get tested too, because we've had sex. So to get yourself treatment. So it's very, very important to also let your partners know, so that both of you can get treated, both of you can take the medication. You wait the 7 days after you've taken the medication to have sex. If you have had gonorrhea and took medication in the past, you can still get infected again, like I said, if you have unprotected sex with the person who has gonorrhea. So it's in your best interest to tell that person, because if it's a person that you're casually having sex with, like 9 times out of 10 you're going to return, right? But if you taking care of yourself and they didn't know that they had to take care of themselves, then you were infecting yourself, and you're going to have to play this cycle all over again. So you might as well just tell them. What happens if I don't get treated? So, untreated gonorrhea can cause serious and permanent health problems in both men and women. In women, untreated gonorrhea can cause pelvic inflammatory disease, also known as PID. And some of the complications of PID is like formation of scar tissues that block the fallopian tubes, meaning that, every month when you have your menstrual cycle, your fallopian tubes release an egg into your womb to be fertilized. If it doesn't happen, then your womb sheds its lining, which is the menstrual cycle. But if the scar tissue forms and blocks the fallopian tube, that can't happen. So then ultimately you can't have children. Ectopic pregnancy can also happen when it's a pregnancy outside of the womb. So if the egg doesn't get to travel to the uterus, and sperm does travel up into the fallopian tube, and fertilization happens and a baby starts growing in the fallopian tube, like that becomes a problem. That's obviously a problem for the baby and a problem for the woman. Infertility, which I just spoke about, inability to get pregnant, and long-term pelvic and abdominal pain. And because, like I mentioned earlier, for women usually have no symptoms at all, it's imperative that you get tested to check to know, because if you're not having any symptoms, you going about your business, you're not getting tested, like these are the results. In men, gonorrhea can cause a painful condition in the tubes attached to the testicles. In rare cases, this may cause a man to be sterile. Rarely, untreated gonorrhea can also spread, which this is new to me, also spread to your blood and joints. This condition can be life-threatening. See, so like just to be out here having unprotected intercourse, contracting gonorrhea, not getting treated, because it's one thing to get tested and not get treated, and another thing to just not know it all. So to play it safe across the board, get tested. If you turn out to be positive, get your treatment as soon as possible. Last thing, untreated gonorrhea can also increase your chances of getting HIV, because you know that every time you contract an STI, it breaks down your immune system, making you more susceptible to contracting HIV. All right, so that was it. That was actually pretty quick. I still have my outro to do for y'all, still have to do housekeeping stuff, but that was pretty much it. If you have any other questions about gonorrhea, feel free to drop it under the video after I post it on my timeline, in my feed, or in the feed, excuse me. Or, reach out to us, call us at Whitman-Walker Health. Let you know about our testing. Of course, testing is still by appointment only. You have to call, can't just walk in. If you do need an appointment same day, if you got some information like, hey, I came back positive for chlamydia or gonorrhea, and you want to get a same day test, that is possible, but you still have to call. Can't just walk in, have to make an appointment. So for free testing, you need to call 202-797-4439. We also provide COVID testing, which is 202-745-7000, or you can email the appointments at Whitman-Walker.org to make an appointment if you can't, for whatever reason, get through to the appointment line. And of course, I do have to do my spiel about the COVID-19 vaccine. It is available here at Whitman-Walker Health. We have J&J, which is the Johnson & Johnson, and Moderna. Everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine. Unfortunately, we do not have that here, but you can, of course, go online, look at your local health department. So if that's DC Health, it's Maryland Health, same for Virginia Health. And everyone 16 and up are eligible to receive a COVID-19 vaccine, period. Please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us, like I just said, for DC residents, you can find information on COVID-19 vaccine walk-up sites and eligibility at vaccinate.dc.gov. For Maryland residents, you can learn more about the Maryland vaccine distribution process and schedule an appointment at covidlink.maryland.gov. If you live in PG County, they have a registration portal. If you live in Montgomery County, they have a registration portal. Virginia residents, you can also learn about the vaccine distribution process and schedule an appointment at vaccinate.virginia.gov. You should also hit those resources up to see about booster if you are booster eligible. You need to do that, especially with a new strain of COVID-19, or a new variant, let me not say strain, new variant of COVID-19 running around, Omicron. It's out here running around. With his locks needed to be retwisted. Omarion don't have locks no more. Never mind that joke, but either way, Omicron is out here. So check all those resources to see if you are booster eligible and what makes you booster eligible. So you can get that done and be a bit more safer. And also, of course, remember to follow us on IG, Facebook, Twitter at Whitman-Walker Health. At Whitman-Walker, and checking our website for the most up-to-date information in our services and more for COVID-19 resources in general, Whitman-Walker Health Services. Follow our programming and Whitman-Walker family at Real Talk DC _ No Filter DC, and The Corner DC. That's it. Have the rest of your happy Wednesday.